We have come up with an important topic on snoring or obstructive sleep apnea. Snoring is very common. People they snore, and some people will also have obstructive sleep apnea. So it's important that you go to the hospital, do a proper test, and make sure that you don't have obstructive sleep apnea. And if it's just plain snoring, you can also you can try some of these exercises at home for your snoring. Why do people snore? People snore because the airway gets narrowed. As the soft tissue increases because of the fat or any other reason, the airway gets narrowed, and when you breathe in through that narrow passage, it makes sound that is snoring. Now, what will happen if there is snoring? Number one, you will not have a proper sleep. You'll disturb your partner. You may disturb other people in the house. You cannot have proper sleep. As a result, next day you have daytime sleepiness. You will have lack of concentration, irritation, maybe accident while driving. It can also lead to some long-term complications such as blood pressure, high blood pressure, diabetes, and heart disease in long run. Firstly, you have to reduce the weight. Weight reduction is the first approach towards snoring or obstructive sleep apnea as well. No treatment is effective as long as you don't reduce your weight. So first thing is weight reduction. So how to reduce the weight? What can reduce? You have to take increased amount of green leafy vegetables, fruits in place of high caloric diet. Reduces starch and sugar intake. Number two, you have to do regular exercise. Exercise can you can go to the gym, you can go for swimming, you can do cycling, you can go for jogging, you can do walking. Any type of exercise is good. That will not only keep you physically and mentally fit, it will also help with your snoring. Dietary. There are certain diets such as dairy products or fatty things that increases the mucus secretion. So when the mucus secretion increases, it also will increase the severity of snoring. So the next is the sleeping posture. If you sleep supine like this on your back, there is your tongue will fall back and it will narrow the air passage, so it will lead to increased snoring. You can either sleep by side, or you can also sleep on your stomach. That's known as the prone position. So these are the certain sleeping postures that you can maintain. The other thing is elevating the head end of the bed while sleeping. So some people they sleep without the pillow directly flat, or some people would use additional pillow or increase the head end of the bed so that your breathing, the airway opens up and your breathing becomes easy. There are certain other things that you have to avoid, such as if you are a smoker, the smoke irritation will lead to swelling of the soft tissue and it will narrow the airway passage. So you have to avoid smoking. Alcohol or any sedative drugs, you have to avoid at least 3 hours before going to bed. Even if you have to take alcohol, make sure that you stop taking at least 3 hours. By you have to finish your alcohol by 7 p.m. if you sleep by 10 p.m. So at least there is 3 hours gap so that you don't go into deep sleep and then it will lead to obstruction in the airway and it can be risky. Avoid too much tea, coffee, avoid alcohol, and avoid smoking. So these are the avoidance that you have to do. If you have nose block also, it can lead to snoring. So if you have allergy in the nose, you have to use allergic medication. I've already made a video on nasal douching, how to wash your nose. You can do that nasal douching to open up your nose. Or the other thing is, humidification. You can buy a room humidifiers, and then humidification will also help. The other is the cycle between not enough sleep and snoring, and then again next day not enough sleep, that leads to snoring. So you should have enough rest and sleep properly. You can also try some breathing exercises. You can do diaphragmatic breathing and also do some tongue exercises. Take it out and hold for at least 5 seconds. You can do that. Protrude as much as possible. So these are some of the home remedies that you can do for snoring. However, you have to go to hospital and make sure that it's not obstructive sleep apnea that needs other type of surgery or devices to open up your airway. Otherwise, it can lead to serious medical conditions or complications. So you have to go visit the hospital.